Hello, my name is student Dr. Rivera, and I'll be taking care of you today. What brings you to the office today?
I'm having pain in my right ankle.
All right, I'm gonna go through a basic history so then we can get this pain resolved. When did you start feeling this pain?
I slipped down my stairs about 3 days ago at my house.
Is there any other area of your ankle or foot where you feel pain?
No.
Has the pain been constant or inconsistent since you started feeling it?
It's been pretty constant.
All right, how would you describe this pain? Sharp, dull, burning?
Initially it's sharp and then it gets dull, and then if you ask me right now, it's pretty dull.
All right. Have you done anything to alleviate the pain?
Just icing it when I'm sitting.
Is there anything that makes the pain worse?
Usually walking and standing makes it worse.
All right, is there any time of the day that the pain gets worse or better?
No, just pain when I walk and I stand.
All right, where would you scale this pain? 10 being the worst, the pain you've ever felt, and 1 being barely noticeable?
Like a 7, I'd say.
Right now. All right, perfect. Now, have you had any hospitalizations within the past few years?
No.
Any major illnesses as an adult or child?
No.
Are you caught up with your immunizations that you're aware of?
I believe so.
Are you taking any medications?
Just ibuprofen for headaches.
All right. Do you have any food, medicine, or environmental allergies?
No.
Are you aware of any blood transfusions you may have had in your life?
No.
Have you been diagnosed with any emotional or mental states?
No.
Health states. Are you aware of any medical conditions or passings of your immediate family members on your father's side?
Grandfather is known to have hypertension, but they're all alive.
All right. And then same thing for your mother's side. Is there any medical conditions or passing on your immediate family members on your mother's side?
No, they're all alive.
All right. Lastly, we're just going to go with some general questions about you to finish this up. On average, how well and how many hours do you sleep per night?
Around 7 hours a night.
All right. Would you say you have a low, moderate, or high active sexual life?
Moderate.
All right. Do you smoke of any kind?
No.
How would you say you manage your work school life?
Pretty good. I mean, I make sure to try balance graduate school and my social life.
All right, perfect. How many days a week are you physically active?
I walk my 2 dogs most weekdays in the evening.
All right, so you have 2 pets at home?
2 dogs.
Correct. How would you describe your day-to-day diet?
It's overall healthy. I try to focus on eating like whole foods and stuff.
All right. Do you drink alcohol of any kind?
No.
Do you take any recreational drugs?
No.
What is your marital status?
Single.
And then have you traveled within the country or internationally within the past few years?
No.
All right, next I'm gonna go through a partial lower extremity exam. First I'm gonna do your vascular exam and then your dermatological exam. Is that okay? Palpable. Palpable. I'm gonna reach behind your knees, is that all right? Palpable. 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 We'll reach behind your knees. Is that all right? Palpable. No observation of ulceration, dry skin, or open wounds. Hyperpigmented skin observed on the right leg. Temperature, proximal to distal, good. Slightly elevated underneath the lateral malleolus of the right foot. Hair growth good throughout. Interdigital space, left foot good. Interdigital space, right foot good. Toenail observation, left foot good. Toenail observation, right foot good. Normal range of motion, left foot. No, I'm gonna reach behind your leg, is that okay? Equinus, negative, left foot. Push against my hand. Push against my hand. Strength, normal, left foot. Left foot. Limited dorsiflexion. Limited inversion, eversion. First ray of motion, normal, good. Reach behind your knees, okay. Equinus, positive for right foot. Push against my other hand. Push against my head. Strength under normal. Good. Good. All right, I'm gonna do your last group of exams. Let me know if you feel any discomfort, all right?
Okay.
This first test, just let me know when I poke you, all right?
Okay. Poke. 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 Poke.
Perfect. Now I'll be doing your left foot, your right foot.
Poke. 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 Poke.
Perfect. Now I'm going to be performing a sharp dull test. I'm going to put it on the front part of your leg. Let me know if I'm poking with a sharp or dull object.
Okay. Sharp. Dull. Sharp. Dull.
Okay. Other leg. Let me know if I'm poking with a sharp or dull object.
Okay. Sharp. Dull. Sharp. Dull.
Perfect. Next, I'll be doing a Levinsky test on the plantar, on the bottom side of your foot. All right.
Okay.
All right. Can you flip on your stomach for me, please? For this test, I just ask that you relax your leg, all right?
Okay.
All right, flip over for me, please. And stay in a seated position. Please relax your leg. All right, perfect. Lay back for me, please. Last test, I'm gonna do a vibration test. Just let me know if you feel anything or feel vibration, all right?
Okay. Yes. Yes.
All right. Okay, for this next test, just let me know if I move your first toe towards or away.
Okay.
It will be your left foot first.
Okay. Toward. Away.
Good. Right foot.
Toward. Away.
Good. All right, I'm gonna look at the area of your concern a little bit more.
That hurts a little bit.
Just a little. Alrighty. Well, my diagnosis for your area of concern is gonna be a moderate to light lateral ankle sprain. You seem to only have pain when inverting your ankle, and your pain gets better when you're in a neutral non-weight bearing position. This is due to the trauma event, I believe, and my observation during the partial lower extremity examination, which included a focus on your ankle joint. So my perfect plan for you is gonna be a prescription of 400 milligrams, taken every 4 to 6 hours as pain requires it, and then take this with food if your stomach gets upset while taking it. This is evaluated by a student, Dr. Rivera. And I'm also gonna order any ultrasound or MRI of the area of your concern, and those results can be faxed or brought to you when you follow up in 2 weeks. You follow up in 2 weeks. During this 2 week period, Only weight bear as tolerable and elevate as much as possible when you're stationary. I'll also give you some stretching exercises to keep the mobility of your joint when you're stationary. And then you'll also be fitted for a CAN boot. This CAN boot will be during a 2-week period. Take the prescription as needed or any over-the-counter anti-inflammatory medication for the area, and then also ice if it still becomes swollen in these 2 weeks. And then when you come back for your 2-week follow-up, we'll reevaluate you in your CAN boot. Are there any further questions?
No.
Thank you for coming. Have a beautiful rest of your day.
Thank you.